Good morning, everyone, and welcome to Global Health Uncensored, where we cut through the noise and engage the real voices shaping health systems, leadership, and the future of global health. I'm your host, Dr. Banda Khalifa. Today, we have a truly remarkable guest, Dr. Tom Frieden, who is one of the most influential public health leaders of our time. Dr. Frieden is a physician, global health leader, and an epidemiologist who has spent more than 40 years on the front lines of protecting health. He served as director of the US Center for Disease Control and Prevention for almost a decade, and as a commissioner of the New York City Health Department, where he led landmark initiatives. He's now the president and CEO of Resolve to Save Lives, a global health organization working with countries worldwide to prevent epidemics and reduce cardiovascular disease. And now in his new book, The Formula for Better Health, How to Save Millions of Lives, including your own, Dr. Frieden distills 4 decades of experience into clear, actionable roadmap for individuals, communities, and governments. The book is already the #1 new release on Amazon. In this exclusive episode, we will trace Dr. Frieden's journey from clinician to global health leader and the leadership lessons that endure. We'll tackle the biggest issue in front of us, what's failing global health today, and we'll unpack his new book, The Formula for Better Health, and its practical framework for saving millions of lives. Dr. Frieden, it's an honor to have you on this podcast. Welcome to Global Health Uncensored.
Dr. Khalifa, it's an honor to have this conversation with you, and I'm looking forward to what we discuss.
Yeah, so I usually like to go back to your origin story so that at least most of my viewers who are early career professionals, who are even some back in medical school, will learn what it takes to achieve such a monumental achievement. In my first encounter, I would like you to, walk us through what drew you to public health and what moments made you realize that, saving lives isn't only about clinical medicine, but also systems, politics, and survival.
Early on, I think I was still in college. I was hiking with my father in the mountains, the Blue Ridge Mountains of Virginia. And my father was the biggest influence on my life. He was a wonderful cardiologist, kind and gentle, thoughtful. And he commented that I seemed to like policy and political issues, and I seemed to like science. And that when you combine those two things, you get public health. I had never heard the term public health before. And that was kind of the beginning of thinking that I might want to go into public health. I also had a first job. It was actually between college and medical school. I was appointed to work for a group called the Appalachian Student Health Coalition, which was run out of the Center for Health Services at Vanderbilt University in Tennessee. And I was assigned to a health center in rural West Tennessee in the extended Mississippi Delta area. And I tell the story in the book, but to cut to the chase, the health center was beautiful. It was a gleaming new building. And the community was just astonishingly poor. People were still living on dirt floor tar shacks. I had never seen poverty like that in the US. And yet, the building was empty. Mm-hmm. People weren't coming in. So I did a rigorous study. I didn't know how to do studies back then, but I did a rigorous study. I did a simple random sample, which nobody does, but I didn't know any better. And I interviewed truly random sample of nearly 350 households. And what I found was half of the people didn't know the clinic existed. 80% didn't know that it had a sliding fee scale, and if you didn't have much money, you wouldn't have to pay very much. Essentially, nobody knew that it had a van that would take you to and from. And what's more, the people who knew were the people who didn't need to know. They were more socially mobile, less in need. So that really taught me that communication is never as good as you think it is. Yeah. And it's not enough to have health services. You have to have health services that engage with the community.
I think this is very enlightening moment for you to kind of decide which career path you'll be taking as you move along your clinical training. And I know you also became New York City's health commissioner shortly after probably 9/11, one of the worst catastrophes of our lifetime. What were some of the hardest lessons about leading in a moment like this, especially in the forefront of public health trauma and, at the time where trusts were all under siege?
One of the issues was the importance of being scientifically rigorous. Obviously, the World Trade Center created massive problems, physical and psychological. And there was a mandate and a willingness to support people whose lives were upended by these terrible attacks. At the same time, it's not a blank check, and you have to be able to say, what are the conditions that are proven to be associated with exposure, and to be able to change that over time as we learn more. So this was really a connection of really good science with really responsible public policy to say, if this cancer or lung disease is demonstrated to be associated with World Trade Center exposure, then people will get access to healthcare and compensation. If it's not, it may be a terrible tragedy, but if it's not related, it may sound heartless, but it's not at least something that the World Trade Center funding should support. In order to do that, we had to enroll the largest registry ever created, more than 400,000 people with exposures to the World Trade Center collapse, and then establish a means to connect with them and track them for decades. Mm-hmm. So this was an enormous challenge and a balancing act between being compassionate but also scientifically justifiable. I think a second big challenge was seeing past the apparent problems, huge dust clouds, huge problems in the environment, to the problems that are most deadly. And this, to anticipate a later part of our conversation, this really anticipates the formula for better health. It's an approach that's been proven to save millions of lives, and you can summarize it by 3 phases. See, believe, create. See the invisible, believe that what might seem inevitable can be changed, and then work together to create a healthier future. And part of the C was seeing what was really toxic, but may not be so apparent. That included smoking in New York City restaurants and bars, which was quite deadly and quite harmful for the people who worked there and the other customers, but had been accepted as something that couldn't be changed. So I think part of the problem was to address this very apparent, very traumatic situation compassionately and rigorously. But part of the problem was balancing things that were in the headlines with things that were invisible but killing lots of people.
Yeah, I can only imagine how tough you had to make those decisions, especially that moment in time. And so you have an amount of experience also dealing with infectious diseases, from Ebola to H1N1. You've led through crisis after crisis. What would you say were some of the most agonizing decisions you had to make whilst you were at the US CDC? And what did it teach you about leadership under pressure?
I think perhaps I don't know if it's hard, but just stressful, is the need for speed. And government systems aren't geared for speed. When I joined CDC a long time ago, in 1990, as an epidemic intelligence service officer, we were told that if a state or country requests assistance, you will be on a plane before the sun goes down that same day, or someone else will be. And that kind of urgent response, whether it's a visit or a response to a request by phone or Zoom or email, that's really important. In an epidemic, time is lives. And what we found in Ebola was that we were getting further and further behind. We were collecting too cumbersome information. We were trying too complex interventions, and we weren't keeping up with the virus. And until the speed got better, we couldn't get ahead of it. And there were a few interventions that allowed us to move with speed. One was using an incident management system framework. For example, in Lagos, Nigeria, the scariest moment of my time at CDC, when we could have had a horribly explosive spread of Ebola throughout Lagos, throughout Nigeria, throughout Africa, that could have continued for months or years and could have killed tens or hundreds of thousands of people, not just from Ebola, but because Ebola shuts health systems from malaria and childbirth and pneumonia and other things. And that was really close to getting out of control. But because the Nigerian government identified effective leadership and used an incident management system, they were able to rapidly get control. But I think the most agonizing things were seeing huge problems coming or spreading and not being able to galvanize action fast enough to deal with it.
Yes, and I think this is truly a very important element in even pandemic preparedness, especially in developing countries when you talk about speed and how a lot of bureaucratic procedures impede that strategy. And you've been at the government sector and now leading a nonprofit, Resolve to Save Lives, which is doing an amazing work in and out of the US. How different would you say is steering a nonprofit versus a government agency when life systems and politics are still on the line?
They're all important. You'll never get rapid progress throughout an entire society without the public sector in the lead. But civil society organizations really can make a big difference. They can advocate, they can support, they can identify ways forward. At Resolve to Save Lives, we work on the world's deadliest problems, and we partner with communities and countries to co-create solutions that can be scaled up to address those deadliest problems, whether it's epidemic prevention with things like the 717 timeliness metric that helps countries continuously improve their response, or getting rid of artificial trans fat, something that countries, more than 50 countries have done, that's protecting more than 4 billion people and will prevent nearly 10 million deaths from heart attacks. So I think the really satisfying thing about non-governmental organizations, or at least about Resolve to Save Lives specifically, is our ability to be nimble, to work quickly, and also to try things. You know, in the government sector, if you try something and fail, you're worried that you're going to get blamed. In a non-governmental organization, we might try 3 or 4 approaches before we find one that works. The 717 metric, as an example, 7 days to find every outbreak, 1 day to report to public health, 7 days to have all control measures in place. That was the 3rd or 4th attempt we had at a useful timeliness metric. And that one really works. It's now being used by up to 50 countries. It's been adopted by the World Health Organization, the World Bank, the Pandemic Fund, the Global Fund, and others. But more importantly, it's helping to accelerate, increase accountability, and increase advocacy for strengthening what is fundamentally public health infrastructure to keep us all safe. So the value of a nonprofit organization is to be able to prototype and try out different things, and then to prove they can be scaled, and then to partner with the public sector, with governments and international organizations to scale them up and sustain them for the long term.
Awesome, awesome. I think like we've in my line of work we come across the 717 frameworks most of the time, especially at the WHO, where I'm currently serving as advisor to the Epidemic Preparedness and Response Technical Advisory Group, and I think it's a wonderful framework. So for many young professionals and even for graduate students in our public health institutions who are seeing the inspiration from your work, what skill sets or mindsets would you say matter most if they want to lead, not even within their communities, but they want to extend that leadership on a global scale?
I think the 3 most important skill sets are, first, data analysis. You have to be able to look at a complicated problem and try to get deeply into what does the data actually show. And this is complicated. I discuss it in my book, The Formula for Better Health, what is technical rigor? And it's not necessarily randomized controlled trials. I'm a tuberculosis control specialist. That's my background. The first RCTs were done on tuberculosis. We know how to treat tuberculosis because of fantastic RCTs done around the world. So I love RCTs, but they're not always the best way to study every question. And it's really important to understand that. They are the best way to study some questions, but not all questions. So understanding data analysis, understanding the kind of deep, granular knowledge of a specific topic that can let you read an article that's just coming out and saying, oh, these are the strong points, these are the weak points, this is why it's really important, and this is why it's probably not accurate. That's really important. That's our lifeblood in public health, to be able to understand the path to progress in the formula see, believe, create. Part of the see is not just see the threats that are coming, whether they're microbes like Ebola or toxins, but also see the pathway to progress. And that's what technical rigor is for. So that's the first important skill, data analysis. The second is effective communication, and that includes listening. Probably the biggest failure in COVID was our failure to listen, to understand what communities were seeing, hearing, willing to do, believing. Ironically, while the US was failing to do that, my organization, Resolve to Save Lives, was partnering with more than a dozen countries in Africa to do just that, with multiple rounds of surveys to understand what the public perceptions were and adjust public policy so that they would not lose the basically connection with the community. And the third, in addition to good data analysis and effective communication, is good implementation skills. This is a big challenge. And this is an area where, again, I talk about in the book, in the create phase of see, believe, create. What does it take to organize, prioritize, simplify, communicate, overcome structural barriers to progress in public health? And for implementation, there's nothing that beats working, trying, learning from people who have been successful, and learning from our own and others' failures, because we don't always succeed. Sometimes it can be very discouraging. We'll feel like a real failure, but the only real failure is the one you don't learn from. So learning from the challenges, learning from mentors, to learn that implementation skill, data, communication, implementation, see, believe, create.
Awesome, awesome. And I think these are truly the foundational tenets of public health, especially in this time that we are in. I know most programs, do well with data analysis and perhaps, implementation science and some course in implementation science. As you said, I think one of the key areas that hopefully public health institutions will step up is in the area of effective communication, because we've seen how things are going downhill because we are not able to communicate or listen to the public that we are trying to protect. Your journey has been remarkable and you're doing amazing work. I want us to also talk a little bit about what's failing global health today. I know that every agency that I know, every organization, students, early professionals, they are all distressed about current issues in global health. So if you had to name one issue as the most urgent threat to global health right now, what would it be and why?
The answer to that question will depend on how you define things. And I think if we step back, we will say that this is an inflection point. Mm-hmm. The first quarter of this century, from 2000 to 2025, was in many ways a golden era for global health, with massive increases in investments, huge successes in vaccination, HIV, and other areas. And we're entering a new period. So I'm going to give a very concrete issue that's urgent and a very theoretical issue that I think is important. The urgent issue is malaria. The only thing that's irreversible is death. Mm-hmm. And a lot of children and babies are dying because of the rapid, unplanned, and frankly irresponsible discontinuation and disruption of US and other global support. Malaria is a terrible killer. And in many countries, when it comes to healthcare burden, malaria is king. You really can't begin to deal with other things until you deal with the high rate of malaria-related illness. It's so common in some places. I remember one community I was in, I made an unscheduled stop, a quick stop to see how a health post was doing. Very dedicated nurse, and she was doing RDTs on people who came in with fever, and she had an 80% positivity rate. And what was so remarkable about that is that the RDT had an 80% sensitivity. So essentially everyone in that community had malaria. And how are you going to deal with other things? You also have to recognize, they give kind of a saying, you know, Occam's razor is the saying we often use in medicine and other areas, that you should find a parsimonious explanation. So if you can explain 3 symptoms with one underlying pathology, that's likely to be the right answer. But in lower income countries, Occam's razor doesn't cut it, because people have malaria and pneumonia and some other condition and some other condition. So I think in terms of urgency, nothing beats malaria in terms of the number of childhood deaths that are going to happen unless we take urgent action. In terms of a more conceptual approach, I would say our biggest challenge is the importance of increasingly using data to make decisions. Using data to make decisions. What does that mean? That means looking at what are the real causes of illness, injury, disability, and death. What are the real things we can do to make a big difference about them? Right now, there are way too many people making estimates, which are really nothing more than guesses about how big problems are. And particularly in lower income countries, I think what is going to be most transformational is unleashing the power of good data systems to empower the leaders of those countries to have real insight into what is making people sick and which of those things are easiest to control and how good are the programs to address them. This is the C part of the See, Believe, Create formula. See what the trends really are. See what's really happening with programs. See the technically rigorous pathway to progress. Use data to improve decisions. That's the bottom line in public health. If we can empower people to have data sources that are timely, valid, important, measurable, and modifiable, then we empower people to make a lot of progress. In too many countries, not just lower income, all over the place, you have assumptions of what's happening rather than facts about what's happening. Mike Bloomberg likes to say, in God we trust, all others have to show us the data.
I think that is a good summary to the state we are in, where people make assumptions, use anecdotal stories to justify some important decisions. I think that is a perfect summary. You've also said that health progress is fragile. For sometimes I feel it's too early for us to have forgotten the lessons from COVID-19. In your opinion, what lessons from COVID-19 do you think have already faded, and what could it cost us in the next pandemic?
People don't want to talk about COVID-19. They don't want to think about it. And there are a lot of really inaccurate and frankly irresponsible conclusions. We haven't had the kind of 9/11 commission about COVID-19 that would have been so helpful. Here's my take. During the pandemic, there were fundamentally 3 phases, or at least you can think of it as 3 phases. The first phase was before we had a vaccine. The second phase was during the initial rollout of the vaccine. And the third phase was when we had enough vaccine. In each of those phases, something else was really important. In that first pre-vaccination phase, traditional public health measures, including isolation, contact tracing, masking, business closures or indoor closures, those were really important. And the countries that did better at that had many fewer deaths. So when you see these, kind of these people with a disease that I'd call pontificitis, where they like to pontificate about things, where you see these journalists writing, or even public health people or health people writing, saying, oh, it was such a mistake, masks don't work, contact tracing was irrelevant. You ask, at what phase of the outbreak? Because in that first phase, those traditional measures were extremely important, and they weren't done well in a lot of places, and they were done a lot better in other places. That second phase, when vaccines were coming in, it was a question of speed to reach the people at highest risk of death, and that's the elderly. So I think healthcare workers, you have to vaccinate because they have to care for people. But other than those two groups, I think it was a mistake to clutter the prioritization with the non-elderly. And the countries that did better said, we're going to vaccinate the over 80s, and then the over 70s, and then the over 60s, and then we can work on the high-risk people. Simplicity is key. And again, in that formula for better health, see, believe, create, one of the components of create is simplification. Leonardo da Vinci wrote that simplicity is the ultimate sophistication. And Steve Jobs used that in his first shareholder letter for Apple. But really, it's important because if you don't simplify, you're not going to scale effectively. So in that second phase, when we had vaccines, but not enough, getting them out quickly to the people most in need was really important. One of the things that the US did do reasonably well was vaccinate people in nursing homes early on, because that was ground zero for the pandemic. And that was something that a group of us had recommended early on. The third phase was when there was enough vaccine. Then it's an issue not of speed, but of reach. How well are you reaching people who need it? And countries and parts of the US that reached a higher proportion of the high-risk people did better. So I think it's important to think a little more broadly about the pandemic, when it was a problem, which phase, what to do. By that third phase, when the Omicron variant came in, traditional public health measures were of much less importance because it was just, a tsunami of infections. I think the three lessons are that we need a renaissance in public health, that we need a robust primary healthcare system, and that we need resilience in society.
Yeah. And I think you've laid it out very convincingly, because most often what we tend to do about our whole experience of COVID-19 is to lump everything together, lump all the faces together and criticize the whole thing. But I really like the way you've laid it out from, the perspective of the different phases and what measures we had to put in place. And I know, currently, public health and politics go hand in hand. And most often, especially in developing countries, we often talk about political will. And I know, you occasionally argue that waiting for political will is a dangerous myth. So if, let's say, government had just $1 extra per treatment dollar, what would you say should be, or should that prevention money go?
So let's talk about politics, because we at Resolve to Save Lives, one of the things we talk about often is what we call TOP, T-O-P, that we need technical rigor, operational excellence, and political savvy. The idea that medicine and politics should be kept separate is just wrong, right? I mean, what we do hope is that there isn't a partisan infestation into public health. And unfortunately, we're seeing that now with some ideological approaches. But really, when we think about making political progress, this is the longest chapter in the Formula for Better Health because it's the most complicated, it's the most difficult. We are always going to be the underdogs in public health. We're always going to be underfunded, underpowered. But that doesn't mean we won't make progress. There are ways to make progress and to build confidence in that progress. That's the believe part of see, believe, create. But the hardest part of create is to overcome barriers. And that means getting rigorous about political will. Political will isn't some vague concept. Political will is about winners and losers. Who wins and who loses from the current state of affairs and from an initiative that we're trying to get across. And how can we empower the winners and mitigate the opposition of the losers? The losers might be the tobacco companies or polluters or companies that are making unsafe vehicles. These are entities that we'll lose if we pass laws and regulations and implement policies that help everybody, but not as visibly. So who are the winners? Who are the losers? Who are the deciders and who are the influencers? You know, when Tabaré Vázquez became president of Uruguay, he was an oncologist, and he decided that he was going to prevent cancer not by giving chemotherapy, but by implementing the best tobacco control program in the world. And he did that. So sometimes the deciders and the influencers are going to be pivotally important. You always have to know that landscape. Which are the advocates and champions, and which are the partnerships that can make a difference? What's the timing and the pragmatism? Maybe there's an election coming and there's an opportunity to do something right now, or maybe can't happen now, but keep your powder dry, and in a year it'll happen. When I was in New York City as the tuberculosis control officer, we had been advocating for years to get our clinics renovated, a multi-million-dollar effort, and we got it approved. And then Mayor Jenkins lost the election to Mayor Giuliani. Mayor Giuliani came in, and we thought we were going to lose our clinic renovations. The New York Coalition to Eliminate Tuberculosis wrote to Mayor Giuliani demanding that the clinics be renovated. That letter triggered a response from the mayor saying, yes, we will renovate those clinics. Now, the remarkable thing was the New York Coalition to Eliminate Tuberculosis, this was handmade letterhead printed on or typed on a manual typewriter by a person named Charles Ehlers, who was a cured tuberculosis patient. And actually, Charles was the New York Coalition to Eliminate Tuberculosis. There was nobody else in it. It was just a one-person show. So it shows that advocates can make a really big difference. And if we had to do just a couple of things, first thing you do is implement health taxes on tobacco, alcohol, sugary drinks, and unhealthy foods. That's a huge win. It gives the government lots of money. It makes people healthier and saves lives, and it reduces healthcare costs. So any government that doesn't do that is basically not taking on the killer industries. And governments that do it should be praised, and governments that don't, we need to be encouraging them to do it. Within the healthcare field, we need to look at the silent killers, especially cardiovascular disease. It's 1 out of every 3 deaths. Hypertension itself is 1 out of every 5 deaths. And yet in Africa, control rates are in the single digits in most countries.
I think it brings us an opportunity to maybe highlight this double-edged sword of chronic diseases and epidemics as you lay it out. Cardiovascular diseases still kill nearly 80 million a year, but global health sometimes still behaves like the next virus is the only threat. What would a system look like if that system truly balances both communicable and non-communicable disease prevention?
I think we should focus on the word primary. Primary prevention through public health and primary care in the healthcare system. And although primary should be number 1, these are both afterthoughts. Public health is an afterthought for funding within government systems, and primary care is all too often an afterthought within healthcare systems. And a system that addresses epidemics, including the epidemic of cardiovascular disease and cancer, well, has to address both of those things. Doing the really good public health programs. You know, the modern day equivalent of safe water and safe air is actually tobacco taxes and getting contaminants out of our environment, lead, PM 2.5, and others. So that primary prevention is crucial. And yet that does take getting coalitions, being strategic, getting progress. Because if you look at still the world's leading killer is tobacco, and fewer than 1 out of 5 people live in countries that are taxing it adequately. So we're not doing a good job on primary prevention. And in terms of primary care, we're also not doing a good job. And for primary care to improve, we've been working on this at Resolve to Save Lives, partnering with countries. And we, with countries, are learning a lot of important lessons. Two of the essential gaps are basic logistics, enough medications, valid equipment, and good information systems. When you look at the transformation, the epidemiologic transition, many conditions now need to be treated for many years or lifelong. High blood pressure, high lipids, diabetes. The systems that were set up around the world were for episodic illnesses, child illness, pregnancy. That needs to continue, but we need to wrap in long-term support. And that can only be done with practical information systems. What we see in so many countries, it's painful, is not enough medications for the most important conditions and not enough information to empower healthcare workers to support their patients. And to address those two things requires prioritization. Prioritization to get the medications that are most important to everyone who needs them. Prioritization to be realistic about digital connectivity, about electricity and hardware and software and what people can do in digital literacy, so that you have systems that really are able in the healthcare system to demonstrate progressive universalism, meaning you start with the conditions that are killing the most people, that we can do the most about, and you provide services to those who will benefit most, and then you expand to more conditions and more people.
Okay. And you also talk about the element of prioritization. I want us to, briefly highlight, the global backslide and the funding cuts that already happened. I know major modeling predicts millions of preventable deaths if global health funding collapses, and we are seeing it collapse in front of our eyes. What do you think is at stake, and how can we protect essential programs from political whiplash?
Well, there are no silver linings to what's happening now. We need to organize, we need to align, we need to see where there are possibilities for additional resources. Health taxes are the best way to get revenues, and then prioritization and using the formula to see the big threats, to believe we can change them and phase-wise expand that, and to create a healthier future. That's the way forward to get not just through, but past this, not to build back, but build forward to more country-owned systems that use data to drive progress.
Dr. Frieden, I've had the opportunity to read an advanced copy of your book, The Formula for Better Health, and I have to say it's incredibly insightful. It's clear, unapologetic, and deeply actionable. I think what struck me most is how you managed to connect system-level reform with deeply personal day-to-day health decisions. So I want us to spend some time talking about your new release. So the framework, and I know throughout our conversation you've made references to see, believe, and create. Your book introduces a three-part formula: see, believe, and create. Why those three, and why now at this particular time? What makes this the right moment to reframe global health through this lens?
This was something that I began working on 10 years ago during a time when the Ebola outbreak in West Africa was out of control. And it was clear to me that a lot of people didn't really understand what public health is, why it's important, why they should support it, or within public health, really how to succeed. And I want to say at the outset that proceeds from the book will go to groups and projects working for health around the world. Nothing comes to me. And the See, Believe, Create framework is a proven approach to close that deadly gap between what we know will save lives and what we actually do, both as a society and as individuals. The C is to see the invisible, to make invisible threats visible, whether they're microbes or toxins or trends whether programs are failing or succeeding, why, to see why we ignore some of the warnings, and to rigorously see the pathway to progress. The believe is about believing, building confidence that progress is possible, even in these difficult times, because it is. We have great tools, we can do great things. And then the hardest part, as if seeing the invisible and believing the invisible weren't hard enough, the hardest part is to work together to create a healthier future. And I break that down into organizing, prioritizing, simplifying, communicating. And then once you have a simple, organized, well-communicated approach, overcoming the inevitable barriers that we face in public health. It's a book about hope, but it's also a book about how to get it done. Not just blind optimism, things are going to be fine, but what do we need to do to systematically make progress? And I have to say that I learned a lot in writing this book. I learned, for example, why? Why do we ignore so many warnings? Or what was Alice Hamilton doing, and how did she have such success, and what was the failure of the society to listen to her? So there are a lot of things in here that are from other people's experience, some from my own, but it's really about the approach that can save millions more lives.
Yeah. And I think you also describe a little disconnect between what we know and what we can do, or what we do, as you term it, the deadly gap. Why does this gap persist even in countries with world-class data and resources? And what would it take to close that gap systematically? If you can briefly, talk to that concept.
I think the working title for the book was How to Break Public Health's Cassandra Curse. But then I found out that most people don't know who Cassandra was. And so that wouldn't have been a very good title. But Cassandra was a mythological priestess from ancient Greece who was blessed with foresight. She could see the future, but she was cursed. Nobody would believe her, so they didn't change their behavior. And the tragedies that she foresaw came to pass anyway. Terrible. Can you imagine that? You're seeing people are going to die, the people around you are going to die. You tell them, do this and you won't die, and they don't listen to you, and you watch them die. Terrible thing. She went crazy, actually. Public health has been like Cassandra. We can see the future, but we can't convince people to change it. So this is an approach to breaking the Cassandra curse. But what I realized as I did research and thought about it was, why? Why do we ignore warnings as society and as individuals? And fundamentally, it's that our perceptions of the world are inaccurate or incomplete. Our perceptions of ourselves. We may think we have more purview over our decisions than we do. We may think we have complete free will, but we don't really. Whether it's advertising or tobacco products or social norms, a lot of our own behaviors are things that we do because people around us do. We also have inaccurate perceptions of the world. We may not realize that little things lead to large improvements or harms. This is what's called the prevention paradox in health, that the invisible things make the biggest difference often. It's also true we have inaccurate perceptions about the future, something called hyperbolic discounting, where we really don't take account of future events or even past events as vividly as we should. So the trick is to break that Cassandra curse by understanding what's driving it and then coming up with ways to counter each of those drivers of that part of human nature that leads us not to attend to deadly warnings. And I go through that in the book in detail, applying it not just to society, but to us as individuals. There's a personal health message here as well.
Yeah. And I think the book also highlights the strength of prevention. One of the lines that really hits me is that a single life saved by heroic surgery is seen as a miracle. A million lives saved by prevention are invisible. How do we shift that mindset, both for policymakers and the public?
Well, it's been said that culture eats strategy for breakfast. And we may not be able to shift that mindset. Occasionally, you get a public health leader in or a leader in who understands public health. And I have to say, Mike Bloomberg does. And so he was clear when I was health commissioner. He asked me one question: is this going to save lives? I said yes. He said, then we'll do it. You don't get that very often from political
Yeah.
leaders.
Hmm.
So you also need stories. People aren't generally convinced by data, but they may be convinced by stories. Not inaccurate or irresponsible stories, but real stories. Take the example of parents whose children died from influenza and didn't get them vaccinated against influenza. They're the best messengers to tell parents, please get your kids vaccinated against the flu. So I think we need to make visible the invisible. We need to show progress. Need to show progress in things that people really care about so that they'll have more confidence that we can deliver a healthier future.
Awesome. And I mean, I want you to give us one core takeaway from this book and also your experience in general. If our listeners walked away from this episode with just one lesson from your book, what would you want that to be?
There is an approach, a formula that has been proven to have saved millions of lives, and it can save millions more, including your own. It involves seeing what's really happening, seeing past the obvious to the real threats and status of our efforts to protect people's health. Believing that we can make progress, because we made a lot of progress in the past, and we can strengthen that belief by making stepwise progress forward and creating a healthier future by prioritizing, organizing, simplifying, communicating, and overcoming the barriers by empowering people who will benefit from public health progress. A life where deaths at a young age are, let me say this differently. It is possible to have a world where death at a young age is very rare, where people live healthy into old age and without decrepitude, without dementia. That life is possible if we follow the formula for better health.
And finally, as I said earlier, most of my listeners are uh, global health or public health professionals and students. And I know most of them will not have the opportunity to meet you in person. So if you had 60 seconds to speak directly to the next generation of global or public health leaders, what would be your wake up call to them?
Public health is a great place to work. Archimedes supposedly said that give me a lever long enough and the right place to stand, and I can move the world. How many people can come to work in the morning and say, if I succeed, people who would have died or been injured or disabled won't be? That's a wonderful place to work. Use this focus to understand the data, to see the real trends, to build confidence in progress, to create a healthier future, because there's no profession that is as satisfying as public health. You do work that's so meaningful, saving millions of lives. You learn all the time because we're all learning all the time. And that's really refreshing, satisfying for adults to be learning. And it's great to work with so many other committed people, learning with each other, learning from each other, and working together to walk into that healthier future where death at a young age is rare.
Dr. Frieden, thank you so much for this powerful and timely conversation. Dr. Frieden's new book, The Formula for Better Health, How to Save Millions of Lives, including your own, is now available. I've read it myself, and I can say it's for anyone who wants to live longer, lead better, and help others do the same. You can pick up The Formula for Better Health by visiting Amazon and most of the bookshops near you, including MIT Press. And you can follow Dr. Frieden on Twitter and on LinkedIn, I do myself, to keep up with his latest work and what he continues to do for global health. Thank you for tuning in Global Health Uncensored. I'm Dr. Banda Khalifa. Until next time, stay committed to building a healthier future. Bye-bye.